حضورنا الكرام في هذه الحلقة، وهي سلسلة من الحلقات نسميها سلسلة الأربعاء البحثي، وهي الحلقة الثانية في الموسم الثاني من هذه السلسلة. مس أماني أصرت أنه أذكر سلسلة الأربعاء البحثي عشان مهم نعطيها الاسم والانطباع بالأكاديمية وبالببليك إن قطر. هذه السلسلة ينظمها قطاع البحث والدراسات العليا في جامعة قطر، وتعني بالأبحاث والاختراعات الحديثة وتقديمها إلى الجمهور وطرحها بأسلوب موضوعي علمي وبسيط. في هذه الحلقة سوف نناقش موضوع البحث العلمي والجدل حول لقاح كورونا داخل قطر وفي مختلف البلدان بشكل عام. معكم أو يدير هذه الحلقة هادي ياسين، أستاذ مشارك في الأمراض المعدية ورئيس قسم الأبحاث في مركز البحوث الحيوية الطبية في جامعة قطر. يسرنا في هذه الحلقة استضافة الشيخ الدكتور محمد الثاني، وهو مدير إدارة الصحة بوزارة الصحة العامة. أهلا بكم شيخ محمد في هذه الندوة. وكذلك البروفيسور ليث أبو رداد، وهو أستاذ في علم الوبائيات الأمراض المعدية ومدير المركز المتعاون مع منظمة الصحة العالمية WHO لتحليل وبائيات الأمراض في جامعة ويل كورنيل للطب في قطر. أهلا بضيفينا الكريمين.
يا هلا دكتور ياسين، مساك الله بالخير أنت وجميع الزملاء والأخوة الضيوف حضور.
نتشكر مجددا حضوركم في هذه الندوة البحثية، ونبدأ معكم شيخ محمد. يمكننا القول أن قطر كانت من أنجح الدول في مواجهة وباء كورونا، طبعا بتضافر الجهود بين مختلف الوزارات والقطاعات في الدولة. يعني إذا قسنا فقط مثلا عدد الوفيات مقارنة بعدد الإصابات التي حدثت داخل قطر نراها أقل بكثير من بقية البلدان المجاورة وغير المجاورة. إذا أمكنكم شرح أسباب هذا النجاح وكذلك التحدث عن الوضع الحالي لوباء كورونا داخل دولة قطر.
بسم الله الرحمن الرحيم. احنا حقيقة سعداء نكون معاكم اليوم في هذا اليوم المهم، وشراكة جامعة قطر نشكرها على عملها ايضا معنا في خلال تضافر جهودي كما ذكرت تضافر. الحمد لله دولة قطر كانت من انجح الدول في العالم في التعامل مع الوباء، بحيث انها وازنت اشياء كثيرة. اولا كان في خطط علمية مبدئية مبكرة لحماية الدولة مع متابعة الوضع كان في الصين وشرق آسيا. ثم لما وصل المرض عن طريق دول أخرى غير حظر الصين، كان في تضافر جهود، وكانت حقيقة النظام الاستراكشر الهيكلي لتنظيم الأمور من هيئة وزارية إلى لجنة الكورونا بين الوزارات، بين أيضا لجنة استراتيجية للكورونا، أيضا اللجنة العلمية واللجان المتحولة في الأسلحة الطبية أو رعاية الصحية الأولية أو أسبيطار. فكانت هذه اللجان تصب بشكل صحيح وبشكل متتابع، كانت اجتماعات دورية. وأيضا الدولة أكرمت النظام لما قدمت دائما بسرعة فحوصات كانت غالية الثمن، لأن نزل سعرها بشكل واضح مقارنة في السابق بشكل فارق، ولكن كان في كرم في الدولة. وكنا من أول الدول اللي حجزنا من أفضل أنواع جودة التطعيمات اللي هي فايزر وموديرنا، وايضا جونسون واسترازينيكا احتياط، ولكن ركزنا على فايزر وموديرنا وهم كانوا الام ار ان اي. كان هي قفزه علميه ايضا تعتبر بالنسبه للبحوث، ان التاريخ كثير من الناس كانوا متشائمين ان ما يطلع التطعيم الا بعد 18 شهر، ولكن استعمال العلم وتعاون العلماء حول العالم استطاع انها تقرب المسافات. هاي كانت اسباب كثيره. طبعا احنا نقدر دور الجامعات، طبعا جامعه قطر وجامعه كورنيل، ذات دكتور ياسين حضرتكم مع الفريق اللي معكم، والدكتوره اسماء الثاني، ايضا الدكتور ليث الفريق معاه مع الدكتور جافد شيخ. كان في فضل كبير ان تعاون البحوث اللي تمت في هذه السنه ونص ما شاء الله تساوي كثير من البحوث في عده سنوات في وقت سابق. فهذا الفضل ساعدنا جدا ان معلومات تكون علميه، والحمد لله دوله قطر وصل لاعلى نسبه من التطعيم من تطعيمات ذات جوده عاليه واضحه فعاليتها في الدوله. وفي نفس الوقت ايضا ما اغلقنا الدوله، احنا ما صار عندنا ريل لوك داون، ما صار عندنا اغلاق تام، المطار مفتوح، الناس تقدر تتحرك في السياره، فكان حتى الضغط النفسي على الناس اقل من غيره. شكرا.
شكرا شيخ محمد. في هذه الاوقات نرى ان الكثير من المتحورات تخرج بين الحين والاخر من معظم الدول، تقريبا كل دوله عم يطلع عندها متحور جديد. أو نعرف نحن أكثر من 70% من سكان قطر هم من الوافدين، وبعد العطلة الصيفية نجد أن الكثير من الوافدين سيرجعون إلى الدولة. ما هي التدابير التي تتخذها الدولة لمنع انتشار المتحورات التي تنتشر في باقي الدول في هذه الأيام؟
نعم، هو كان تحدي عندنا كبير طبعا على دولة قطر. مثلا يعني ان شاء الله الطيران القطري قد يصير في اي وقت في الشهور القادمة اكبر طيران في المنطقة الشرق الاوسط، يعني حاليا هو رقم 2 وقد يحصل. فعندنا انتشار لجميع الدول ولازم متابعة، لان هذه ايضا حتى تحط احنا قطر في خطر معين اذا ما ضبطت النظام. فاحنا الحمد لله عندنا نظام قوائم خضراء وصفراء وحمراء للدول عشان ما نظلمها، نقيم من مستوى في البلد، والدول تتحرك بالاخضر والاصفر والاحمر على حسب الظروف الحاليه. فهذه الاليه احنا نحاول نعدل. فالاخضر ما يكون عليه حجر، يعني اذا كان موجود، الاصفر عليه شروط اضافيه، والاحمر عليه حجر اطول مده، يعني 10 ايام الاحمر، 7 الاصفر، و5 الاخضر. بالاضافه اذا مطعم نشجع التطعيم، دخولك يكون اسهل. طبعا صار عندنا تحديات، احيانا نسمح في الاطفال او لا نسمح في الاطفال اللي غير مطعمين. الحمد لله اخذنا خطوات ان نراعي ظروف اسرهم ونسمح لهم، لان اطفال تحت 12 سنه ما يستطيعون الطعام حاليا، ما في التزام دولي على تطعيمهم، فلازم يكون في تسامح مع هذا الموضوع. لكن كما ترى ان التحدي هي انواع، يعني احنا مرت علينا عده انواع من المتحورات، وكل متحور يكون من دوله مختلفه. فمثلا بيتا جانا اكثر شيء من ساوث افريكا، الجاما كان موجود في البرازيل اكثر، والدلتا كان اغلبيته في الهند في البدايه. فكان كل دوله يتغير النظام لحمايه، ولكن قررنا ان ما نقطع علاقه مع الدول. الحمد لله كنا نعمل، يعني نقول لهم ضحوا شويه في الحجر، ولكن في المقابل انك انت تدخل البلد بدل ما نمنع دخولك من البلد بتاتا. وكان هذا النظام ساعدنا كثير في نظام الحجر، انه يساعدنا تنظيم الحالات والفحص المبكر، خلى في حركه، في شويه تعب، ولكن الناس تتحرك وتروح وتيجي بسلاسه مع الفحوصات الاضافيه.
شكرا شيخ محمد. I will switch a little bit to English and move to Dr. Leif. But before we do that, just want to ask the participants online to send their questions through the Q&A session, and we can also ask them to Sheikh Muhammad and Professor Leif. Professor Leif, one of the key success points in facing and battling the COVID-19 in Qatar is using scientific-based data and analysis in order to build the strategies of the country. And I know that you have done a lot of research and a lot of data analysis in that regard. So how did research, what kind of research has been done, and how did the research help in facing this problem in Qatar?
Yeah, so thank you very much for the opportunity today for this discussion. So if we take as an example vaccine effectiveness studies worldwide, we will find that most of these studies came from 5 countries, from the United States, United Kingdom, Israel, Qatar, and Canada. So, which is pretty really amazing that the 5 countries leading in the world in terms of vaccine effectiveness studies include Qatar, which is actually the smallest of all of those countries. So this is just an example of how effective scientific research in Qatar has been in supporting the national response and actually the global response at the same time. But this does not only apply to vaccine effectiveness studies. We have seen a proliferation of scientific research on COVID-19 really very much in all aspects, in all the institutions and through national collaborations. If we calculate how many scientific papers were published per capita, possibly Qatar is one of the highest worldwide. So why we have been so successful on the scientific front? This is simply because of the investment on scientific research that started more than a decade ago. We are just seeing the fruits and the outcome of this investment. Just like any other investments really in Qatar. For example, Qatar invested in building an excellent airline. Now it's the world leading airline, best airport, and so on. So scientific research is just another outcome of the investment that actually has happened. So in terms of scientific research and the national response, before even the first case was discovered in Qatar, already a team was formed as part of the national response, national collaboration, including, of course, led by the Ministry of Public Health, to see what we need to do to confront the epidemic. One of the first things were done is, of course, to project how many, what healthcare needs we will need in terms of acute care beds, ICU beds, and so on. So all of that planning was science-based and allowed us to prepare well for the epidemic. So at no time really we were behind, so to speak. We did not see the situation that we've seen in other countries where they were so strained. Many of you recall in the earlier days. Fortunately, this actually did not happen. Very much all decisions in Qatar are come after scientific research. For example, when are we going to put restrictions? When are we going to ease restrictions? How fast we are going to ease restrictions? All of this is driven actually by scientific research. So I think we see here a very unique example in our region where science has been playing a very important role, and not only to as part of the national response, but also to inform the global response as well.
Very much indeed, Dr. Laith. You mentioned like Qatar is in the top 5 countries in terms of studying and reporting on vaccine efficacy. If you can give us like a brief about vaccine efficacy, especially against the variants that are circulating, the Delta and other variants of concern.
Yeah, so the vaccines were originally developed for what we call the wild type variants. These are the original variant that started in Wuhan, and the vaccines work very, very well against these variants. Now, however, the virus has been evolving. So against the Alpha, however, the vaccines work very, very well. No problem really, just like the original variants. Against the Beta, however, it's lower. It's against infection, the protection is only about 75%. Still, 75% is really great, you know, but it's very, very, very strong. Against the Delta, it's also actually lower. It's just about 55% against infection. But this is also in part because some people got their vaccine a while ago, so their antibodies went a bit down. But these are the efficacies against infection. The efficacy against disease remains above 90% against all variants. And this is, at the end of the day, is the most important for us. What we want a vaccine that protects us against going to the hospital, protect us against becoming with severe disease or having to go to an ICU or la samhallah dying from the infection. The vaccines are working extremely well in this regard, no problem. But because of this evolution of the virus, against infection, they are less effective. And this is why we are seeing more and more breakthrough infections, vaccinated persons getting the infection. But most of those who are getting the infection, by the way, are getting it asymptomatically. They don't show any symptoms. It's a very, very mild infection that does not really affect them much.
One thing that people really don't know when we talk about vaccine effectiveness, there's no vaccine that gives 100% protection. Reaching 95% or 90% or even 85% in COVID-19 vaccine, that's really an excellent achievement. But still people are talking about this breakthrough infection. People are vaccinated but still getting infected. You mentioned they are having milder symptoms. Can you just like scientifically explain a little bit why this breakthrough infection happens?
Mm-hmm. Sure. Yeah. So what happened first when let's say I got the vaccine, right after the second dose, my antibodies reach a very high level. So at that time, I'm protected very, very well. But with over time, the antibodies start going a bit down and down. So what does this mean? The antibodies remain in my lungs, remain at a very high concentration. This is why people who are vaccinated and get the infection, they don't develop severe disease because the antibodies in their lung are very, very strong. They are very protected against severe disease. This is where severe disease starts. However, in the nasal cavity, in the upper respiratory tract, the concentration of antibodies go down. As a consequence of this, then people get the infection, the virus starts replicating in the upper respiratory tract, but cannot reach really the lung. So this is why they get the infection. We have breakthrough infections, but they don't cause disease. The vaccine remains very, very effective against disease.
Thank you, Dr. Laith. I think this is, I don't want to go deep into the scientific explanation, but this depends on the type of vaccination. Those that can give mucosal immunity versus humoral immunity. The vaccines that we are taking right now, they don't give mucosal immunity. Usually, if you need mucosal immunity, you need a live attenuated virus, like some of the influenza vaccine, polio, or whatever. But I will move back to Sheikh Mohammed. So there is talk about a third shot of vaccination because, as Dr. Professor Laith mentioned, the antibodies are waning over time, and we'll have more of these breakthrough infection. Maybe not necessarily we are having more severe cases, but we still have infections from time to time. What's the plan in terms of giving a third shot in Qatar, in Ministry of Public Health? So what's the plan for the third shot?
Yes, thank you, and thank you, Dr. Yassin. And as you know, that third shot has been many research done that Dr. Laith was leading part of this research in Qatar to see how much the antibodies wane, and there was proven that from the research that the antibodies start waning mainly after 8 months. It becomes more significant. Start waning from the start, but slowly. But after 8 months, it may be worth it to have additional vaccine for people, and it may wane more after 12 months. We don't know exactly how much it will wane, but in the coming few months, we'll know how much it will go, the risk. But till now, we see that when you are away from the second dose, 8 months, you have a high chance to be infected, not to go to a hospital or for death, but you start having more vulnerability to be infected and infect other people while you think that you are protected. So this is the risky. We started already in Qatar by this taking decision for all the people who are weak in immunity, like cancer patients or organ transplant, and people who have problem in immunity. We give them a third dose, and we don't call it a booster dose as much as it's like it should be for these people at 3 doses to assure that you get enough immunity for the virus. Now the plan is going that we started vaccinating people in January, mainly the elderly. So logically, because they are elderly and 8 months away, they are more suitable to start vaccinating them for a third dose to assure that immunity stay high from infection, because any elderly from this age, if they become positive, we will take more responsibility to take them to hospital to check them, because they are very vulnerable by age and by type of disease. So inshallah, you can see very soon that people who finish 8 months, they will be vaccinated, and we will decide later when everybody should have the vaccine after the second dose by 8 months or 12 months. As you know, some people just get the vaccine last month, so that they are not eligible for third vaccine. But we are recommending a third dose to make sure that people are more protected, but it will go gradually for the coming months.
Thank you again, Sheikh Mohammed. So another explanation for also little bit of scientific background why we need a third shot for those people, like especially students and researchers. So basically, the vaccine is given, especially in Qatar, we're given at, for example, day 0 and 3 to 4 weeks later. And we know, in terms of immunology, that does not give long-lasting immunity. If we look at other vaccines that are given, like polio or measles or any other viruses, we give either 3 shots and we give a longer interval between them. And this is when maybe why the immunity is waning. So, but understood from you now, pretty much all the population will be provided a third shot, which is a privilege that is not found in many countries. So this is one of the privileges and the good things that Qatar does. But are you going to start with the immunocompromised, then move to the other population, or you just afford it to all population at once? In addition to that, is there a time limit where you are going to consider the vaccine ineffective, or for example, you don't consider it for your national response plan?
Yes, for now, yes, for now we started already open vaccination for people who are immune compromised. All the people who are immune compromised, most of them, they are welcomed, and we called them, and they are vaccinated for the third vaccine as protection. Now we are thinking about to open it more for the elderly and go forward for the others. Till now, we didn't decide for all the population because it doesn't seem that young are at risk and they are still getting their first two doses. I agree that there was some studies that say if you can make the interval more than 4 weeks to 8 weeks, maybe it's better. But due to the risk that wanted to vaccinate people, give them the first to increase their immunity while during this dilemma of the COVID during the last months. So we make it only 3 weeks or 1 month, just to cover their antibodies quickly. But maybe in the future we have different plans to when to get the second dose and the third dose, and what should be the fourth dose, maybe, if to keep this going until we find a proper treatment that can protect people from going to the hospital. So for now, we got the immune compromised. Hopefully in the coming month, we'll get to the elderly who passed 8 months, and slowly we're gonna go later, like people who just finished 6 months, they are not eligible. They should wait at a minimum 8 months and preferred before finishing 12 months. But this will be calculated as, God forbid, we didn't see, alhamdulillah, for the last, if you can see the difference, the first 6 months, we have more than 360 case death. Now, since 2 months and a half, we have only 13 cases. So by this logic, the next half quarter of the year will have maybe 90% reduction in deaths. So we need to evaluate, does really people lower than 40 years old need a third one or not? This can be clarified in the coming month or more. But we prefer the elderly and the weak immunity to start getting them after 8 months. Thank you.
Certainly, Sheikh Muhammad. So basically, as you mentioned, we initially gave it like the first shot and second shot within like 1 month interval, just to reach the herd immunity as soon as possible, to protect as much as we can from the population. And then maybe later on, we might need a seasonal COVID vaccine like flu, for example. And as a scientific fact, flu vaccine itself is not much effective now. I think like it ranged in the effectiveness of flu vaccine can drop to 30% and might reach 70%. So with the COVID vaccine, we have much more protection. And when we have herd immunity, bigger herd immunity, then like hopefully things will go back to normal. Another question to Sheikh Muhammad before we move to Dr. Laith again. Are we close from from this pandemic? Like when is gonna finish? When the country will open and we have the normal life?
Yes, I know that people are really having suffered for 1 year and a half with this mental problems by this close, and everybody wants to go to back home. The good thing that we have good results around the world, that many countries were being attacked and now they have very low number of cases. But really, the virus is very special virus. It's tricky. When countries go down, another countries increase again. First was Europe and America and Brazil, and now suddenly we can see Japan and Thailand and Malaysia, countries that we never thought that we have high increase of cases has been increased. Plus some countries that cases never went down easily, like Russia and Iran and Mexico. So if you check the world map, there is no country similar to another country in the world. But we are hoping now that technology of the vaccine, and as the test becomes cheaper even for other developing countries, the way how to contain it will be easy, and it will be like an endemic disease that every country has it, but not everybody will be dying from it because most of the people already either having vaccine or infected. So the case will not disrupt the system of the economy as before. And sooner or later, we saw already brave decision from some governments to go. Some of them are very bold and risky, but some of them are brave. And I think this slowly will keep coming back to normal slowly in the coming months.
Thank you, Sheikh Muhammad. Thank you for your patience, Professor Laith. Another question, it might look trivial, but just for the general audience to understand about this pandemic. Are we gonna really eradicate this disease or this virus like we did with the smallpox, or no, it's gonna be like similar to other seasonal influenza, seasonal coronaviruses, and other respiratory viruses?
Yeah, unfortunately, right now, it looks the latter rather than the former. And why is this so? The problem with this virus is extremely infectious. And with the evolution that happened, infectiousness has increased. For example, the Delta is very, very infectious. The reproduction number now with the Delta is somewhere between 6 and 8. What does this mean? Really, the only way we can eradicate this virus is to have a vaccine that is extremely efficacious, which we actually don't have right now, and also reach 90%, over 90% vaccine coverage everywhere in the world, everywhere. Now, unfortunately, this looks very, very difficult to achieve. Now, definitely there is work on vaccine development to developing more powerful vaccines against COVID-19 and possibly even one vaccine against all coronaviruses as well. There are actually smart designs that are being looked on, but this will take time. It's also, we don't know whether this will be successful. So really realistically right now, given that we really cannot reach herd immunity practically, really in reality, the most likely scenario is exactly what Sheikh Mohammed was talking about right now. We probably will have to live with this virus. It will continue with us. It will be quite possibly seasonal virus. However, that does not mean we will live the kind of life we have been living right now. We will be able to neutralize it. So and how we were going to neutralize it is using these vaccines. So if you think of COVID-19, COVID-19 is basically a monster, but the vaccines have made it just a very small annoyance. Yeah. So I think how is going to the future is going to be. It's simply COVID will stay quite likely, but it will become very normal. Everyone will be vaccinated. They will have the protection, or they would have previously got infected. When they get in a breakthrough infection, it will be a mild infection, but they will continue with their life, just like how we were living always, by the way, with influenza, with other respiratory infections. Oh, today I have a cold, okay, that's it. We move on next day, So COVID will no longer be scary. COVID will be just like any other cold virus, basically.
As a matter of fact, in 2006, there were 2 other coronaviruses that emerged in the population, most probably also like from zoonotic infection, from infection coming from animal, the HK1 and another virus. And they are one of the reasons, one of the viruses that continue to circulate in the population. And I was told some outbreaks happened in Qatar during this pandemic with 229E. But as you said, they cause mild symptoms, they don't need hospitalization. And this is why many people go do the test, but they are negative for corona, but might be positive for other viruses. You mentioned herd immunity. Can you explain to the public what's herd immunity? What's the level of herd immunity in Qatar compared to the other countries?
Yeah, herd immunity is what proportion of the population that needs to be immune in order for the infection to stop spreading in the population. So if we reach herd immunity, then the virus cannot actually spread anymore. We reach this herd immunity only really against one infection so far, which is smallpox. That's it. We are actually very close to reaching herd immunity against polio. In fact, we reached herd immunity against polio in most countries in the world. It remains only 2 more countries. If we reach herd immunity there, we will also eradicate polio. Measles is another example where we are pretty close to reaching herd immunity, but means still substantial work remains ahead. So this is really herd immunity. How much do we need to have as immune, a proportion immune in the population to stop the virus ability to propagate? We don't yet have that for COVID-19, unfortunately. We have very effective vaccines, but not perfectly effective vaccines. So this is why we cannot actually reach it at this point.
Yeah, it's kind of a relative measurement. The whole idea is just to protect as many people as we can. So limit, not eradicate, at least limit the virus spread and limit the cause of acute, cause of critical infection. In that regard, many people are asking, are pregnant ladies advised to take the vaccine?
Yes. So pregnant women were not included in the original clinical trials because we always have to be very cautious about pregnant women and their, babies. So they were not included in the clinical trials. We did not have the data. But since then, we have now lots of data. By the way, even one of the vaccine effectiveness studies for pregnant women was conducted also in Qatar, and the results were excellent. So now all guidelines have been changing to recommend vaccination for pregnant women. Pregnant women, in fact, need really to get vaccinated because COVID during pregnancy can cause substantial severe consequences. Also, by being vaccinated, they will give maternal antibodies to their newborns. So they are protecting as well their babies. So yes, pregnant women need to be vaccinated.
This problem of vaccination pregnant women is very important against other viruses as well. We talk about Zika, although there's no vaccine for Zika, but we know infection of pregnant women might lead to congenital illness in the newborns, or the same thing with measles and rubella. So vaccination of pregnant women is very important. Even, for example, for other respiratory virus, the RSV, the respiratory syncytial virus, it causes clinical disease mostly in young children or new infants between 0 and 6 months old. But there's no vaccine. They are trying to vaccinate women as you mentioned, to transfer maternal immunity to these children and protect them within their first stages of life. Within the vaccine, before I move to Sheikh Mohammed, people talk, what is the best vaccine?
Okay, well, Dr. Sheikh Mohammed, please.
After you can start and then I will complete this.
Okay, great. Thank you. Yeah. So definitely right now we have lots of data on vaccines, and the mRNA vaccines are really the best. This includes both Moderna and Pfizer. Moderna even is a bit better than Pfizer. But here, when I say these mRNA vaccines are better, I'm talking about efficacy against infection. Very much, most vaccines, by the way, are very, very effective against hospitalization and death. For example, AstraZeneca is really, really effective against hospitalization and death. So usually the differences between the vaccines is how good they are in protecting against infection. And here, the mRNA vaccines are the best.
So this brings us to Sheikh Mohammed. If you can comment on this subject, especially you hear a lot about this vaccine effectiveness, the safety of the vaccine, whether this is better than the other one. Some of the vaccinated people are developing serious illness, especially in the social media. If you can comment about this subject, please.
Yes, thank you. As you can see, people are competing always on this, and the quality of the vaccine you are getting and evaluating even your social situation by the type of vaccine you get. But it's clearly that for different reasons, every country in the world did different types. Some people want to go very for the future and went to mRNA, and some people want to be very classic and went to this classic like AstraZeneca and the Sinopharm and Sinovac and Sputnik. So by these different, Johnson have even different third technology. But it was seen that 2 doses is better than 1 dose. People said, I want to get 1 dose, Johnson offer 1 dose, but it's not enough. We are going now with the best vaccines to a 3rd dose. So how about Johnson & Johnson? It's not enough to have only 1 vaccine. The same thing we saw that now China is pushing to do mRNA, and even India to do mRNA, because it's proven that they admit that it is better for the situation, and they inshallah will invest more in mRNA. And we are hoping by this, for us in Qatar, Moderna has been, as Dr. mentioned, a little bit higher. We didn't have any deaths, 0 deaths from Moderna by 2 doses. But there was a small confounding factor that when we started the highest elderly people in Qatar, above 90 and 80, with Pfizer. So we didn't start Moderna, except we start getting people in 70s or mainly 60s. So the people are with Pfizer, most of them didn't die. 99.99, they didn't die. We have only few cases, very few cases died, but because they are 92, 87, 88. So the virus not anymore is as risky or deadly at all, but it is another reason to push the system of the body to go to a bad situation and by death sometimes. So alhamdulillah, they've proven themselves, but of course now the challenge that they are waning a little bit. We don't know exactly how much they can. Maybe they can protect you from death, from dying, or clinical for maybe years, but we are not sure. We don't have any proof till now. But for positivity, it's happening now that some people can be positive if they get it after 8 months. But alhamdulillah, one of this, I think Qatar, we say Qatar is the second country in the world or the third country in vaccination, but I think we are #1 in the number of the people who are vaccinated with high quality vaccine. At the same time, maybe we are the highest country that tests every day. We maybe test every day 1% of the total population, and more around 25% of the community maybe can be tested every month. So this is controlling the situation in Qatar in a better way.
So there are some talk, and even there are some scientific data showing that vaccine could induce some serious illness, like a clotting or some heart issues, so on and so forth. In Qatar, are we following up the vaccinated people for at least a matter of few days to see whether they are developing any severe symptoms or anything like this?
Yes, we are having this following very well, and for the 4.5 million dose, we have maybe less than 20 cases of carditis, and alhamdulillah, most of them get out of the hospital in 2 weeks. The most of the people, of course, complain of headache, fever, myalgia, body pain. These are the main things I think that can be handled better than getting the vaccine. When people complain that the vaccine makes me feel headache or any complaint, I tell them it's better than you get the virus itself, and you will suffer much more if your body is vulnerable for this. But alhamdulillah, with the good system in Qatar and the health system, all these people with some inflammation has been treated and get out of the hospital in 1 or 2 weeks. So this is assuring us with millions of doses, this is a very negligible amount of risk for them.
Is this like, are these data available for the public? So to reduce these concerns in the social media and between the population?
Yes, we mentioned it, but we are mentioning it's very low number, and we mentioned sometimes, but it should not be said in media in wrong way that people understand it wrongly that there is a side effect, because these are side effects. Yeah, we are documenting every side effect and monitoring every case, and there's a phone call, a number to call if you need any help during this period. But this is happening internationally, and we are mentioning it, but we should not mention it in a way that make people worry in a wrong way.
Along the same line, this pandemic has been a great challenge, a big challenge for Qatar and other nations as well. And these zoonotic infections, or the infection that transmit from animals to human, will continue to emerge. We had the flu in 2009. We have the MERS in 2012. Thankfully, it did not spread between a human. We have multiple Ebola outbreaks. What did we learn from this pandemic, and how can we utilize this knowledge to deal with different outbreaks or pandemics that might emerge in the future?
Yes, thank you, Doctor. And this is important to remember that 1920 Spanish flu, which there's a book was written after that after years, called the Great Influenza. And the reason it's the Great Influenza, because before 1920, people doesn't invest much in science. And after that, with the investment on science, the world has doubled their life expectancy after the vaccines and the antibodies that was created in 40s and 50s. So it saved the world. And many people say the 20th century was, although for physics, and 21st century will be for more for biology and biotechnology. And we can see now this virus, although it killed 4 million, but it's logically we're going to save maybe 100 millions in the coming years by the technology that was invested in mRNA and other things. And we are hoping that there's many vaccines are still in the pipeline, many treatments, and we are waiting. We have some treatments now already for this to lower getting to hospital by 80%, but should start early. And anytime we can have tablets that can save people, not only for this virus, another viruses, and maybe we can find a long-term flu vaccines. So we are looking forward by the investment that happened in healthcare in the last years, and maybe some profit happened even will be invested, and we're gonna, inshallah, keep the human being will keep surprising himself by getting more healthy things for people. Thank you.
Indeed, Sheikh Mohammed. A question regarding the public. What's the role of the public, general public, in facing this pandemic? And these people, for example, some of the vaccinated people are taking it easy. I'm vaccinated. I don't need to put the mask. I don't need to worry about this virus anymore. What's your advice? What's the role of the public during this period, especially like the next 5 to 6 months?
Yes, the public, of course, they represent the community and the human being, and some of them are very extremely cautious, and some of them are very extremely risky. So we don't want the extremes. We advise everybody to keep in the middle, the balanced and the wise approach. So some people are still worried; they are not moving from their home, which is not right. Some people are reckless and they are going everywhere without getting some protection. And we ask them: it's not only you are infected; you can infect other people. You can infect someone by yourself that can die from your side. You should be cautious. Of course, now after vaccination, everything is assuring us that we are not like before 1.5 years. This is something, always the past doesn't come back. You learn from it, but you are ready for it. So we recommend everyone go with the recommendations and the policy that the ministry is putting after a lot of discussions with experts and scientific people, and trust that this is good. Like delaying the phase 4 was right, and inshallah maybe soon we're gonna maybe relax the measures more, but people as public should be responsible. We thank the public during the COVID. They stayed at their homes and help us when we needed to control the capacity of the hospitals to a limit. Staying at home help us to keep the best thing for people who are in ICU. And with this disease, it's not much deadly, but one of the worst thing for the disease, not how much they kill or how much they infect, but it's the worst thing that if we get to a number of cases together, that we can't give them the proper service in ICU. Many countries, the very sad thing happened that they couldn't admit cases to ICU and choose the younger to take them or having better chance and keep the others die outside by a decision of a hospital or doctors, which was so sad for them, stressful to take this decision. So in Qatar, we said if some people will be sick, but gradually to give every person the capacity they need. And alhamdulillah, we handled the first wave, and the second wave, even we increased the capacity, make it easier for us even to control the big waves that coming. So public are so important. Their wisdom will affect all the country if they always collaborate with the health sector and their recommendations.
Along the same line again, like people keep asking when we are going to get rid of the masks. Is there a timeline for that or no?
Yeah, we are studying that many countries has already removed the mask outdoors because, it's very proven, Dr. Leith know that outdoors to be infected is lower than indoors, and the time you stay inside and outside. So by calculation, staying outdoors for short time, communicate with people, and if you are vaccinated with the herd immunity, encourage that we hopefully we can move forward for mask outside after getting the approval of the committee for that. But indoors, it will take a bit more time to go forward, although we are studying this more, and there's good positive results. After the third vaccine, maybe it will be easier to take this decision.
One more question before I move to Dr. Leith. It's very critical and maybe a little bit political. In some countries, including some neighboring ones, they are forcing students to get vaccinated in order to go back to school or colleges. Like what's the case in Qatar? Thankfully, in Qatar, maybe 90% of the people already vaccinated or have herd immunity. But what's your say on that?
Dr. Leith?
What's your say about are the students gonna be forced to take the vaccine to go back to school or no?
For me, the question for me or Dr. Leith?
No, for you.
Okay. Okay. So for schools, we didn't. We encourage people, and we are hopefully above 12 to 16. Already 75% has been vaccinated. We are hopefully keep going on. We still see people coming on to be vaccinated. It's not by forcing them at all. We have online 50%. We don't want to force people, but we encourage because we know that people have some time to be vaccinated, and there's always early adopters and late adopters and resistance. We are increasing the late adopter adopters than and smalling the resistant people. I believe now, like 11, 12th grade, they are in need and university to go to at school. I feel many people of the students want to come back to school, understand this. We're saying if you are vaccinated, the class will be encouraged more to be at school. If you are not vaccinated, you should keep wearing your mask properly and keep going to school if you want, but proper mask and go back home. There is more restriction for people unvaccinated that will be relaxed for people who are vaccinated, but we are not planning to. We didn't push any elderly to get the vaccine. So why we gonna make it mandatory for the youngest? We are not going for mandatory, but we hope that the people will be more encouraged by the results of the vaccine, and we get more number of people unvaccinated in school.
Thankfully, in Qatar, like people are responding to the recommendation of the government, and many of them are getting the vaccine, which is a good sign for how the people are well knowledged about this issue and how much they are educated and they are taking the vaccine accordingly. Dr. Laith, in the same topic about vaccine, usually vaccines takes many years to get developed. In average, 10 if you are really optimistic. And some of them, like for example, for HIV, people have been working since the 1980s, early 1980s, on HIV vaccine. But there is no vaccine for HIV, there's no treatment. Why for COVID-19 we had a vaccine within less than a year?
Mm-hmm. Yeah, it's first, each infection is really different. HIV is a very different type of infection where developing a vaccine against it is very difficult. It doesn't work biologically like actually COVID-19. So COVID-19 is one of those infections where it's actually easier to develop a vaccine. Now, we do, by the way, have vaccines developed with as little as 4 years in the past. So it's not out of really the question to develop vaccines faster. But here also, we were very successful in developing vaccine within 1 year. Why is this? Well, the answer is very simple, because there was a massive investment in getting it developed quickly. I will give you one example. When let's say we want to do a clinical trial to test vaccine, we need to recruit people. We need to follow them. This is extremely expensive part of developing the vaccine. This is actually the most, by the way, expensive part of the process developing a vaccine, for which a vaccine or drugs. Currently, for example, it costs about $1 billion to develop a new drug because how expensive are these clinical trials. So normally, what we do, we don't recruit a lot of people because this will add up a huge cost. We only recruit few thousand when let's say we want to test a vaccine. We follow them, however, for a long time to compensate for the smaller number of people. This is why it takes longer for the vaccine to see the results. And in the past, the fastest vaccine took actually 4 years to be developed. Here for COVID-19, the situation was very different. Governments had a very different approach. They wanted to develop the vaccine quickly. So the pharmaceutical companies got billions of dollars. They were told, go and design a clinical trial. Don't bother about the number. Put as much number of participants as you want to get the results as fast as we can. And they did. And this is really shows how things really work, which Sheikh Mohammed indicated this earlier. When we put investment on the right place, we actually get things, get results, get excellent results, and we get them quickly. Unfortunately, by the way, in recent decades, the interest in developing and in supporting vaccine development globally has actually declined substantially, because a lot of the infectious diseases affect the poor populations. For example, malaria, TB, etc. So governments, I mean, rich governments, especially, like United States and others, did not have the incentive to put huge amount of resources in developing, for example, a malaria vaccine. This is why it took actually longer. So the answer really, there is the way the COVID-19 vaccine was developed is in the same way how we develop vaccines always. The only difference, there was massive amount of resources put in order to get the results quickly, especially recruiting larger number of people in clinical trials. Yeah, that's it. But otherwise, it's an example for us to follow in the future, inshallah.
Thank you, Dr. Laith. I think it's a multi-level issue when it comes to vaccine development. It's the virus itself. Some viruses mutate very fast that we cannot develop a vaccine for them, like HIV. Some of them, they don't. Like, for example, polio, we can still do a vaccine. And as you said, a lot of resources were put into developing the COVID-19 vaccine. And in addition to that, as Sheikh Mohammed mentioned earlier, that some nations like US and in Europe, they invest in science. And I know, for example, people have been working in other coronavirus vaccines like MERS. And then when this COVID-19 happened, they just implemented the same strategy, which also like shortened the time. There was this question to Professor Laith. This, like, I'm receiving now some of the students' questions. The WHO recently organized a session on collaborative intelligence and emphasized that it's paramount in the fight of COVID-19. In your view, what do you think harnessing collective intelligence to enable learning through dissemination of data will be an effective strategy in averting or managing the rise of new variants such as Delta variant? It's just mainly what about sharing the data, sharing the expertise between the different nations in order to face this pandemic?
This is a global problem. So of course, it needs really global collaboration in order to confront the problem. And this is why we need this international collaboration. It's very, very important. And by the way, we are doing it here. I mean, Sheikh Mohammed knows very well how actually from the very beginning, we have been, the ministry have been working with counterparts, international organizations in order to actually coordinate the response, share data, and so on. By the way, also all of our scientific work, I mean, we are in constant communication with the WHO, with the US CDC, and so on. We share data with them, they share data with us before even it gets published, and so on, in order really to learn from each other. So definitely, sharing of data and result is very, very critical, and it's actually being done. Now, a lot of people don't see that because a lot of it comes, of course, in private. Usually, when there are new results, we have to take our time before we release them to the public, because we need first to double check them. We need to compare to what other countries have been seeing, and so on. So lots of collaboration is there, and definitely this needs to be continued.
This is like one of the reasons of doing scientific research and publishing the data in peer-reviewed journal, to make sure that this data is validated and like has been reviewed by experts in the field before we put it for scientists and even the public to learn from. Sheikh Mohammed, we are hosting the Arab Cup soon, and next after that we have the World Cup in a year or so. What are the measures that we are taking, and what is the plan to host these events safely and successfully at the same time?
Yes, thank you. This is an important question. Every people who are following sport are checking this. We believe that we were always trying to prepare emergency for World Cup, and COVID also, it was very tough. It was an excellent rehearsal for preparing for the World Cup, make it World Cup easier to handle due to what we saw, and we were tested during COVID. So for Arab Health now, it's like the rehearsal for the World Cup. The World Cup is 32 teams, and this is 16. Half, we're going to use 6 stadiums out of the 8 during this period. We are trying to get as much as we can people in the stadium by different plans, everybody should be vaccinated, and we can make it full house, or 50% except some 20% not vaccinated. We are trying to vaccinate. If we have fans coming who are not vaccinated, vaccinate them when they come to Qatar by Johnson & Johnson 1 dose. These are all solutions that we are planning to. But one of the most things that happened, we were following Euro zone, and we discussed this with Russia health team, because there was many matches in Russia and UK. We discussed with them, and they saw some areas had increased cases and some not. But we are looking forward for maybe testing the people before they attend the match, and this will be an easy thing. We can handle easily 40,000 people to be tested in the same day or in 2 days. We have the capacity to test them before the match, and we can attend the match. We're looking forward to try everything that will be in World Cup during the Arab Cup. Alhamdulillah, with the herd immunity that was mentioned in Qatar, we don't see very high risk of this, and we are asking mandatory the players and the crew to be vaccinated, or they will go in a bubble. They should not go to be in contact with others, and every time before the match they will be tested. So this system is already there. We are hoping till the World Cup we will not do all the measures we are doing now, but it's easily not only to double it. It's only we need to double what we are doing for Arab Health to handle World Cup. With all optimistic that things will be better during the 22.
I believe Qatar hosted several months ago the Asian Championship League. They hosted a lot of games, and I believe that there were some audience in the field. Did you face any challenge during the organization of these events, or it went smoothly and you learned from it that you can implement this new knowledge in the Arab Cup and the World Cup?
Yeah, it was good for the audience. Was controlled, well controlled. There was no real problem from the audience. But the challenge was that many players become infected, and some players infected the other teams. So they cannot play when they are positive, and some people maybe they were hiding they are positive to play the match. So we reviewed our system to assure that we can test people as early as possible to lower the cross infection between the players and the team they are playing against it. So alhamdulillah, nobody died, nobody went to intensive care, but as a whole, it crippled the matches, and many teams couldn't play. Not in Qatar, but like a Saudi Arabian team couldn't come to Qatar because they were infected before they arrived to Qatar. Some players arrived and get positive. So we're trying to keep entertaining the game as much as we can without having positivity stopping them from growing. We learned a lot, and inshallah we will apply it in World Arab Cup.
It's a learning process. So thankfully, Qatar is hosting multiple events, and we are learning from each event how to deal with the second event, and we are taking it gradually until we reach the World Cup, and hopefully we will host it successfully and safely. I'm going to shift a little bit from COVID-19, Dr. Laith. Now in the news, a lot of people talking about the Nipah virus, that we have outbreaks of Nipah virus in India. Should we be scared, or what's the deal with the Nipah virus?
Well, to be frank with you, I have been so busy with COVID-19. I haven't been really following more details to provide really a more informed, response. But it does not seem to me this is actually something like the COVID-19. COVID-19 was really very special situation. We have a very infectious virus where a lot of people who are infected are also asymptomatic. This made it very difficult to control. So if we compare COVID-19 to the original SARS virus, it was pretty easy to control SARS because most people who have SARS have symptoms. So the moment they start become infectious, they start also developing symptoms. So it's easy. We know someone, we can isolate them, we can test their contacts, we can control the epidemic. For COVID-19, the situation is really very different. Most of the transmission happen when people don't yet show any symptoms. It's very, very difficult. This is why to control. So most viruses, when they get introduced from our reservoir, I mean animal reservoir to humans, usually they tend to have more symptoms. This is why a lot of them don't eventually cause pandemics. But of course, just by chance, sometime one of them can actually cause a pandemic, and unfortunately we are going through one right now.
Indeed, Professor Laith. So the coronavirus, as you mentioned, it's different than the Nipah virus. The mode of transmission is different, and the way that the virus transmits between the population is different. So hopefully we are hoping that the people in India can control the Nipah virus before it spread, which is very likely. Sheikh Mohammed, the MERS-CoV, another coronavirus that is still in the camels in some parts of the world. Are we doing anything to prohibit its transmission to human, or what is being done in terms of MERS-CoV?
Yes, MERS-CoV has, we have in Qatar, we have few cases, and we have around 20 deaths from MERS-CoV in the last 10 years. The world was worried about it, especially after a South Korea person who went to came to Qatar and Saudi Arabia and UAE and back to South Korea and infected people and cost Korea around 200 deaths plus $10 billion cost. So this is the world are worried. But in the region, in the GCC, we have the highest case in Saudi Arabia. But it seems that we, by following people in the areas that are the farms, like Al-Shahani and Qatar, we saw that most of the people can be infected there, but they have protection, the farmers who are working there. It's very rarely that it crosses and between animal to human. It's not easy to spread it from human to human till now, 4 years. It's directly from human. And when it's from a human to a human, it becomes less infectious and less deadly. So for now, no news, good news. For years now, we didn't have cases in Qatar, maybe lower in Saudi Arabia. And this is assuring us that it can kill, but it can be limited to spread. But it's always good to invest in countries with camels that you keep investing that this will not spread to other countries. We are hoping that even some studies are happening in Qatar from Weill Cornell, getting from the camel immunity, trying to do some part of why some people are more protected from before COVID because they were infected by MERS-CoV, and trying to understand more about this reason, inshallah. So we hope that this will even give us more information from MERS-CoV. But in Qatar, the situation is very assuring, and this is rarely to happen. Maybe we have, God forbid, one death every few years, and we hopefully that this will not happen easily, inshallah.
We hope so. So I hope it's like the same story like the avian flu, the H5N1 that appeared in the late 1990s. The virus is still circulating in birds, but it's not transmitting to human often, and it's not causing a pandemic. So hopefully the MERS is the same thing. It might be in camel, but hopefully we don't have these major outbreaks of MERS-CoV. But as you mentioned, we still need to invest in terms of science, public health, in order to prevent these pandemics from emerging. Question back to Dr. Lai, this from students or the audience. Some people say, oh, I want to get infected. It gives me better protection than vaccination. In terms of protection, which is better, infection or vaccination?
Okay, so it's a very good question. A protection that comes from infection is more durable and a bit stronger than the protection coming from the vaccine. But that does not mean that people should try to get infected in order to get the protection. This would be very, very bad thinking because the infection has a lot of consequences. So COVID-19, of course, carries risk of death, carries risk of a very severe disease, and so on. And you saw the millions that have already died in the world, and not to mention, actually, the tens and millions who have already went to the hospital and had very severe disease. But not only that, every day, by the way, now we are learning there are more symptoms of long COVID. So it's not only getting the infection now, it's actually the consequences. We are finding consequences for diabetes. We are finding consequences, by the way, even for mental health. There are cases of psychosis. People simply had episodes of losing basically their mind, several months after getting COVID. So it's a very, very risky infection that carries a lot of risk to persons. There is nothing like getting the vaccine because the vaccines have very, very minimal side effects. They protect against severe infection, and also they protect against long COVID.
For sure. So when we think about these viruses, we should not think from personal perspective. Number one, people might look healthy, but they might get the disease and then they might eventually die. But the most important, we have to look at it from public health perspective, because you might infect other people, you might transmit the disease, and more importantly, there's a lot of economical cost of the virus. So thank you for explaining this aspect. Take the vaccine, take the vaccine, take the vaccine. Back to Sheikh Mohammed. Qatar University will start reopening its doors for students starting from next week. And I think they are doing it in multi-stage way. What's your advice for the students?
Yes, my advice that after getting this high percentage of vaccination in Qatar, it's time that people go back to universities, as the school already started going to school. I think it's healthy for the university people, although they can work better online than the young age, but it's time to communicate with their teachers, because some of the experience gotten by physical communication and speaking during the meeting is so healthy. I recommend all of the phases. They should start and should go to the universities and gradually increase the numbers. And I believe usually the university have bigger rooms that can give the right space for people to be there physically with mask, inshallah, or can choose some open areas and stay far away from each other without mask in the future when we remove the mask. But this is healthy that people start going to a normal life and not get used for this crisis, special habits, and go backward. We encourage the universities, but please go with wisdom, do the right thing. Don't go wrongly and socialize in a way that affect. And we think it's from the school, from the students, but it's not from the classes. It's from the socializing behind the university classes. So please get the right way and get the value of going to the universities and get communicating with your professors.
Muhammad, a question might not be very relevant right now because we already passed the era of lockdown, and hopefully we'll not have a lockdown, but just for the general information and general knowledge. Do you think that the lockdown policy applied by the MOPH is going or created more serious illness than SARS-CoV-2, talking about like mental illness, stuff like this? Don't you think that we should take this into consideration?
Yes, first we didn't do a full lockdown. You know, people can go back in their car and go around, and the schools were there and they work online as much as we can. I know, but compared to any other country, we didn't do a real lockdown, and we are not planning in the future to do a lockdown. I know there's, of course, we were worried evaluating people. People die from the disease or have a big complication from mental health and diabetes and hypertension not treated properly in primary health care. This was very evaluated. I think the time we put people in some mental challenge was accepted. It was not big that affect everyone. And I think people who have some mental problems, challenges during these worries, I think they get past it, most of them, because the time of this crisis, the full time before we start again phases and opening, was only a few months.
Indeed. So in Qatar, we did not really have a complete lockdown. It might have been a problem for other countries, but not in Qatar. And inshallah, we'll never have a lockdown anymore. Last word, Sheikh Mohammed.
Yeah, I would like to thank you so much for making these important meetings. It's very valuable that we communicate and connect with people and align our ideas and learn what people think. And we are learning from the questions that were asked. As Dr. Laith said, the achievement, we are debating the achievement that happened in 1 year and the vaccine and others. Believe me, it's the world have decision together. The virus is the most tricky thing to kill people, but when human beings have a will do great achievements. And as they say, when there is a will, there is a way. The world has proven that with unity and with peaceful things, we can achieve a lot. And inshallah, we are hoping, but we are very proud with communication with Qatar University, helping us finding the strange and the biggest number of research done through Dr. Laith and Wild Cornell with us last period. This all help us to grow. And we hope everybody who's listening to us, please, in the work, we work together, because public health is the art and science the art of science, how to protect collective efforts to protect the community. So everybody is listening to us today, please do your part for public health, and you will save people and become a hero for yourself and for your country. Thank you so much.
Thank you, Sheikh Mohammed. Dr. Laith, the floor is yours to say final words in this session.
Yeah, thank you very much, Dr. Hadi. Sheikh Mohammed really summarized it very, very nicely. So just want to add that we are in a very different situation right now from the situation we were in a year and a half ago. We progressed a lot thanks to vaccination. So please, anyone who hasn't yet vaccinated, please do vaccinate. The future now is much better than the past. We already now back to, in fact, not back to normal life completely, but gradually we are getting there. And now we have much more activities than we used to before. I think we will be getting there, inshallah. It's going to be, however, gradual. Everyone needs to be patient, but definitely we can see now more light at the end of the tunnel than ever before. Yeah, so please vaccinate if you haven't, and this will help us all move to a different reality, inshallah.
I think the three of us in this discussion have been vaccinated, so that's a good example. As I mentioned, like, get the vaccine. We really appreciate having you in this session. Thank you, Sheikh Mohammed. Thank you, Professor Laith, and I wish you good afternoon.
Thank you. Thank you so
very
much.
Thank you.
Thank you.
Bye-bye.
Assalamu alaikum.